Good morning and welcome to Inside Tennessee. Along with my colleague John North, I'm John Becker. We are moderating our conversation with an East Tennessee lawmaker, Senator Becky Duncan Massey, joining us once again, representing our community in the state legislature. Always nice to have you.
I always enjoy coming and being here with the four of you all.
We appreciate the time. I'm going to introduce our panel and we'll jump into it. Susan Richardson Williams runs her own PR firm. She's a Republican.
Good morning, John.
Good morning. Don Bosch is a Democrat, runs his own law firm.
Good morning, guys.
Good morning. Senator, you're here because of a new report that you helped push out, and it's in your hands right now. As we get to that, I want to go to some video we have of a place called Lakeshore. It is our most popular park in our community, but it wasn't always just a park. Back in the 1800s, it opened as a psychiatric care facility and was that right up until you got in the legislature a dozen years ago.
But don't blame it on me.
We're not blaming you.
You were saddled with it, but not to blame.
But it did go away. As you mentioned, it eliminated 400 jobs, and many people who needed 24-hour care were shuttled to other parts of our area. What's in front of you right now is a needs assessment about psychiatric care in East Tennessee. This dropped last week. Let's talk about what you're seeing as far as a need goes in our community now and in the future.
Well, I was very much aware of the need, even as we went through it. And so for the last 12 years, I've been at, since Lakeshore closed, in 2013, I guess it was in June it closed, or 12, I guess it was June 30th. I have watched it. I've made sure that the funding that was used at Lakeshore was kept in our community for mental health in our region. It's a 24-county region, but that it was kept in our area and that it was serving people that had mental health needs. But as we've seen mental health needs growing and our population growing, it was obvious this wasn't keeping up with the demand, and I knew we needed to do something.
So this says here's a path forward, because right now patients who need psychiatric care in our community are often taken down to Chattanooga. That's the nearest spot.
Well, we contracted with 3 private mental health hospitals to take care of a lot of the folks that would have gone into Lakeshore. Probably they are more the folks that would have been there for the less than 10 days. 90% of the people that were at Lakeshore were there for less than 10 days. But about half of that 100 that was there when it closed were their full-time permanent residents. So those were the people with more persistent mental illness, and those are the ones that are going down to Moccasin Bend, plus folks coming from the jails, and plus folks that need forensic evaluation.
Why did you have to have this report? I mean, we know because we've been talking to you, but for viewers that are like, okay, so what is the report about? Why do we care? It's important, and why?
Well, when you're looking at trying to get something this big funded by the state government and in front of the governor and the administration to know that this is a priority. I mean, they might like me, but not enough just to say, hey, we're going to need this money.
Check, yeah.
You need the data, and you need the data done by a department of the state. So I had discussions with Commissioner Williams, and we talked about this report. So Senator Briggs and Lieutenant Governor McNally and I did a letter to Commissioner Williams to ask her to do this report and this study so we would have this. I knew it would come out with something that said we do need this hospital. I mean, and just knowing our community, knowing our needs. But it really was an extensive report. They didn't hire a consultant, they did it internally, and I think it's an excellent report with the data that we need. You know, 50 beds now we're short, and within 30 years we'll be short another 50 beds. So the recommendations are there, and now we work with.
How quickly can it be built? Don and Susan, we're going to get to your questions. We're going to take a quick break on Inside Tennessee. Back with more of Senator Becky Duncan Massey and this report about psychiatric care, and we'll talk other legislative priorities after this.